Hi everyone! In today's video, we're going to continue our series on health anxiety and specifically ways to reduce focus on health symptoms. And so far, we've talked about how focusing on health symptoms can promote excessive worry about your health, and therefore one goal to better manage health worries is to be able to gain greater control over how much you actually focus and dwell on your health worries. In a previous video, we talked about the concept of strengthening your attention muscle to overcome the tendency to hyper-focus on physical symptoms, which is often what we see in health anxiety. We talked about the importance of attention training, and I explained some strategies for how you can get better at redirecting your focus in a more effective way. But even if you've been practicing the skills and working on building your attention muscle, you may find that your attention still drifts back to worries about specific physical sensations or health concerns more generally. Now, it's pretty normal for people to have worries about their health, but the more we dwell on these worries, the more anxiety symptoms get triggered. These symptoms can range from increased heart rate to muscle tension, chest pain, lightheadedness, numbness and tingling, all sorts of common manifestations of anxiety that also mimic symptoms of other health conditions. So the more we allow our attention to be fixated on these bodily sensations, the more anxiety we're going to experience. Now, one of the things that can happen in health anxiety is that people attempt to manage their worries by distracting themselves or suppressing the thoughts about health. In other words, if I'm concerned about my health, I might consciously make an effort to not think about it or to avoid or suppress thoughts related to health worries. And while this approach may seem logical, there's a catch. And to explain this problem, I want you to imagine a little experiment. Imagine that I asked you for 1 minute to think about anything that you wanted to think about. Maybe you want to imagine yourself on a beautiful, serene beach, enjoying the sunshine, whatever you want to think about. But for that 1 minute that you're thinking about whatever you want to think about, I want you to try really, really hard to not think about a pink elephant. So imagine yourself on that beach, but no matter what you do, make sure that you're not thinking about a pink elephant while you're on the beach. And when I do this experiment with my clients, what ends up happening is that in that 1 minute, all they can think about is a pink elephant. No matter how hard they try not to think about a pink elephant, the thought of a pink elephant keeps popping into their mind. We call this the paradox of thought suppression. The more you try not to think about something, the more you end up thinking about it. Now, relating this to health anxiety worries, if one of the ways that I'm trying to manage my worries about my health is by trying to not think about those health worries or suppressing those health worries when they come up, what that means is that I'm just going to keep having these thoughts and health worries come up again and again and again because of the paradox of thought suppression. So I'm trying hard not to think about it, and it's the trying hard not to think about it that's causing me to keep thinking about it. So at this point, you might be a little confused, because if focusing on my worries creates more worries and more physical symptoms to worry about, and trying not to focus on my worry may actually increase the amount that I'm worrying, then what exactly am I supposed to do? Well, the third option that we have is something called worry postponement. And this is how worry postponement works. As soon as you notice that initial worrisome thought creeping in, so for example, I notice that I have chest pain and I'm worrying that it might be a sign of a heart attack or heart disease. Once I notice myself thinking that way, the idea is to make a conscious decision not to chase that line of thought any further at that moment. So while I acknowledge the presence of these worry thoughts, I don't allow those worry thoughts to consume my attention. But you might be asking, What exactly does it mean to not chase those worrisome thoughts any further? Well, it means that you resist the urge to focus on the symptoms or the sensations you're anxious about. You refrain from anticipating the absolute worst case scenarios and replaying them in your head repeatedly. So for example, instead of getting caught up in thoughts like, this could be cancer, I think the pain is getting worse, what will happen to me and my family if it is, I should see my doctor. Instead, I consciously choose to let go of those worries for the time being. So I'm postponing my worry about my health until a more appropriate time to worry about my health. The idea is to use those attention skills that we've talked about before to bring your attention and focus back to the present moment. What's happening right now in the here and now. You can redirect your thoughts to the task at hand or to the situation that you're currently engaged in, just focusing on what's happening right now. And so by practicing this technique of worry postponement, you're gaining some control over your attention and you prevent the worries from overpowering your thoughts. It allows you to think about your health concerns with a clear and rational mindset at the time of your choosing, rather than getting tangled up in a web of anxious thoughts and hypothetical worst-case scenario. You're acknowledging the worry, but consciously deciding to postpone it and redirect your attention to what you were doing before the worry started. So that's the idea. That's the rationale of how worry postponement works. So how exactly do you do it? Well, there are 3 steps with worry postponement. And step 1 is to set up a worry time, a designated time and space where you're going to give your worries and your health-focused thoughts all of your attention. So you need to choose a specific time, place, and duration for your worry time. Maybe you decide to do it at 12:30 p.m. during your lunch break, and you'll allocate 15 minutes or even up to 30 minutes if needed for your health worry time. You want to establish consistency, so try to stick to the same worry time every day. This way, it's almost like you're training your mind to know when it's the designated time to think about those health worries. And that's why it's important to pick a time and place that you'll be able to do this consistently. Now, it's important that you avoid scheduling your worry time right before bedtime. The reason for this is because when we dwell on worries and symptoms right before we go to sleep, it can make it much more difficult for us to relax and unwind. So what you want to do is to give yourself some buffer time between your worry time and when you start your bedtime routine. Now, the next step is actually working at postponing the worry. As soon as you start to notice yourself worrying or fixating on a particular physical symptom, what I'd encourage you to do is to pull out your phone and take a brief note of what it is that you're worrying about. The key is to keep it brief, using just a couple of words to capture the essence of each health worry that you're having. For example, I might write down something like, noticed I was starting to have a headache, thought it could be a brain tumor. Once you've written it down in your phone, the crucial next step is to make a conscious decision to set aside those thoughts and to save them for your designated worry time. Remind yourself that you'll have time to think about these worries and physical sensations later on. And by doing so, you reinforce the idea that you have control over your thoughts and you're actively choosing where and when to engage with your health concerns. By postponing the worry, what it does is it gives you the freedom to refocus your attention back to what you were doing before the worry thoughts kicked in. And then the third step is when you actually get to your worry time. This is your chance to pull out your phone and to think about those worries that you jotted down over the course of the day. Now, one thing that's important at this point is, remember, you have the freedom to choose which worries to focus on during this time. If some of the worries that you wrote down no longer bother you or don't seem to be that big of a deal anymore, you can let them go. You don't have to force yourself to worry about every single item on the list if it doesn't serve a purpose anymore. But for all the worries that still require your attention, the idea is to go ahead and dive into them. You can explore the worries, analyze them, and let them have their moment. You're giving yourself permission to engage with these health worries in a controlled way. But you can only focus on these worries for a specific amount of time that you've set for your worry time. And it's really important to stick to the plan. If you allocated 20 minutes, set a timer for 20 minutes. And once that timer goes off, your worry time is over. Now, if you run out of time and there are still worries that require your attention, write them down in your phone and remind yourself that you have another worry time scheduled for tomorrow. At that worry time, you can think about the remaining items that you didn't get to in today's worry time. By giving yourself this assurance, it allows you to let go of those unfinished worries and provides a sense of structure and control over your thinking. So, I'd encourage you to try this out for a week or two and see what happens with your health worries. Do you notice that when you actually get into the worry time, some of the health worries that you had during the day no longer seem that important? Do you find that when you think through your worries during the worry time, and do you run out of things to think about before the worry time is over? Do you find that some of the worries that you had to postpone because you ran out of worry time didn't seem to be that big of a deal the next day during your scheduled worry time? Lots of things to think about, lots of things to pay attention to during the worry time. And the thing is, this is a skill, and like any skill, it requires practice and patience. It's not going to feel natural, and you may not find that it works perfectly the first few times that you do it. But the more you do it, the more you practice this worry postponement, what you'll find is that it does actually give you a greater sense of control over what you're worrying about and when you're worrying about it. If you want to learn more ways of managing these types of worries about future catastrophic events that may never happen, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.